this is where we use our devices. You can do the Genius radiofrequency microneedling. Regular non-radiofrequency microneedling will help a little bit. In addition, the Fraxa will help. And a product that I like for these in this area is called Revox 7. It's by Revision, and it has peptides to strengthen the skin, but it also has some activity like a Botox to relax the muscles. This is an excellent area to improve things with the dermal placement of Botox in an aqua gold-like device that stamps the toxin in a superficial manner, and it doesn't penetrate into the muscle where it's going to have that effect. It really is just improving some of the hydration in the area, especially when you mix it with a little Bellatero in the bottle. I love to do that procedure in some people. The other thing we do sometimes is we take a hyperblended hyaluronic acid. That means I thin it out, and I'll bolus this area a little bit right beneath the dermis to stretch the skin without building the cheekbone. It's not going under the muscle to give you cheekbone. It's going in the skin to help refine the skin in that area. So that's another little trick that I do in some people as well for the lower crow's feet. Obviously, we all know about the tear trough, but one of the lectures I gave back about 10 years ago was about placement of filler in the tear trough, and I emphasized that the lateral tear trough, if present, is much more important to correct than the medial tear trough. When we concentrate filler medially, whether it be in the nasolabial fold, the marionette, or in the tear trough, you run the risk, if you're not totally assessing the patient, of the patient looking like their nose is wider, that they get that rolled sort of simian look or monkey look by completely over-correcting the nasolabial fold. And with a woman, when you inject a lot in the prejowl sulcus and the marionette here, you can cause the chin to get wider, which is masculine. And so you want to make sure that from here to here, on a female, there's what I call angularity. And angularity means that it's a little bit on the sharp side. It's a little more feminine. Now, when that cheekbone is high and you get older, that sharpness can get overly sharp. And it goes from being defined and angular to being gaunt and tired looking. So that occurs because as we age, the cheekbone itself, it's not that it gets flatter. The fat pad flattens. The cheekbone stays the same, but what's happening is the orbit is lengthening and getting wider, and the cheekbone ends up by being more narrow. And that gives you this sharp drop off right about here. So one of the tricks, this has nothing to do with the eyes, but it's a trick that I use that I want to at least mention, on making sure that the inferior aspect of the maxilla is softened so that you can maintain your cheek, but lose some of the gauntness that you can get when you're older, when your cheekbones are super high. And don't let someone make you look like you've got golf balls in your cheekbones. Please talk to your doctor. Look at their before and after picture. One of my little tips is look at your doctor. If your doctor looks weird, there's a good chance you're going to look weird because that's their aesthetic eye. You know, doctors who do a lot of injections are artists, and my art may not be your art and vice versa. So it's very important to have a meeting of the minds aesthetically when you talk to your physician, and that you are on the same page with them, and that you're not a traditionalist and they're a modernist, and you're going to look like Picasso. So please, talk to your doctor and make sure you're on the same page. Tell them your concerns about how you don't want to look, and trust that you've done your homework and gone to a doctor who can make you look the way you want to look. Now, so we've talked about the tear trough, the importance of the lateral. So the lateral will actually compensate for the fact that that orbit is getting wider and longer and making you look tired and gaunt, and that sunken in look. And when you feel the lateral tear trough first, it gives a little pull this way, which makes you need less in the medial tear trough. So you have to address it as a unit. And that takes experience to see that. Now, let's talk a little bit about ways to shape the brow. So I talked about the fat pad. I talked about a little bit in the lateral brow. I talked about doing Botox here to give a lateral lift to the brow, because when you hit the Botox or Jeuveau here, you're getting the superior aspect, the superior lateral aspect of the orbicularis oculi, and that kind of pulls the eye down. So you relax it and you get a counter compensation upward. But we do a lot here and here to shape the eyebrow. And I'm going to be showing you on another talk some actual pictures and the process of brow correction as sort of a teaser for things to come. So one of the things that's important to understand is with the neuromodulators such as Botox and Jeuveau, it's sometimes not as important where you inject, but where you don't inject. Because if you inject in one area, so if I inject here and not here, this part of my muscle is going to get stronger and it's going to raise this part of my eyebrow when I don't inject here, but I inject here. Conversely, if I inject here and don't inject here, I'm going to get a little bit more of a lateral pull. Everyone's aware of spocking, which is when you are uneven and the person's eyebrows kind of go up like that. And that's not a good aesthetic because you look like you're mad at everybody, because this medial aspect is relatively low compared to this, and a low medial eyebrow, the translation of that position is that you're angry or you're mad. So you want to get a lift here. Now, you don't want to get too much of a lift here, because if you get too much of a lift medial, what happens? You start to look sad. Look at me. Look how sad I look. So you want to have an eyebrow that is lifted and flared. So, but you have to be very precise. The doctor has to see how your muscles move, because no one's muscles move the same. If you're following a grid to put your Botox in, I promise you, you're not going to get great results because muscles are so different. So another mistake I see from novice injectors is they lower the medial brow too much. They make people look kind of like this. And what they've done wrong is they've accidentally injected the inferior aspect of the frontalis, and you've lost your ability to lift your medial eyebrow. They were trying to get the corrugators and they missed, and they got the frontalis. So you want to make sure that you're really in that muscle and pinch it when you're going for that, because when you get your corrugators, you get a little bit of a brow lift when it's done correctly. Also, the procerus and the nasalis as a unit can cause the medial aspect of the brow to come down. So when you inject here, you'll get a little medial eyebrow lift. So the point is that when I'm talking to the patient, I'm listening to them, but I'm listening to their muscles, and their muscles are talking to me in a silent conversation. And I know where their muscle is strong. I know where their muscle is weak. I can usually tell people, you know, like a patient will come in and I'll ask them and they'll say you know, I did Botox once before and oh, my eyebrows were so heavy. Well, I know, you know, that wasn't the Botox. That was the injector of the Botox injecting you too low for your eyebrows. So I hope this has been helpful. I'm going to kind of do a PowerPoint that I think I'm going to try to put on Instagram, on TV, that kind of walk through a little bit more of these principles. But your takeaway should be, as I've often said, it's not the filler, it's the filler. It's not the device, it's the deviser. It's who's devising your plan. Who's the architect of your face? Who is understanding your face and how it needs to be renovated? And I encourage you to send me messages. I'm happy to help. You board certified dermatologists out there know that I teach at Cosmetic Boot Camp. And in 1 year alone, I had as many as 13 preceptors spend 1 to 2 weeks mentoring under my instruction at my office. So teaching is very important to me, because the more people I teach, the better results that are out there. And every good result is a feather in the cap of dermatology. So thank you all for listening, and see you next time.